On the Health Watch tonight, older women who regularly eat fried foods are at a higher risk of early death. Dr. Mallika Marshall is here with us tonight.
Yeah, doctor, we love fried food. We know it's not healthy for us, but this is alarming.
We were just talking about how much we love fried foods. Jalapeno poppers and mozzarella sticks.
And pickles.
Well, unfortunately, we shouldn't be eating too much of it because researchers at the University of Iowa studied more than 100,000 women over the age of 50, and they found that those who at least one serving of fried food every day increased their risk of death by about 8%. Now, women who ate fried chicken or fried fish at least once a week had an almost 13% higher risk of dying from heart disease. Now, if you're going to try to find some good news in the study, they did not find a link between eating fried food and dying from cancer, but that doesn't mean that we should.
One way or another, it's going to kill you. That's the.
Fish and chips once a week.
I know,
think that,
right? I think it just soaks up a lot of oil. Plus, it might have something to do with what type of oil the food is fried in, because in places where they use predominantly olive oil, like in Spain, for example, they don't see some of the same numbers,
Not as
right?
bad. Okay.
Frying in olive oil. Well, about 40% of young adults, including more women and working professionals, have at least one tattoo. And researchers at the University of Miami wanted to know what that means, if anything, for their overall health. All right, doctor, so what did they find?
Okay, so this is interesting. I mean, there's a lot of people doing tattoos out there.
Yeah.
They surveyed about 2,000 of them, and they found that having a tattoo wasn't significantly related to someone's overall health status. But those with ink, I'm being very hip there, they're being inked,
Super.
are more likely to be diagnosed with a mental health issue or to report problems sleeping. There also was an association with being a smoker, having spent time in jail, and having a higher number of sexual partners. And past studies have shown an association between these risky behaviors and getting tattoos, but it was interesting to see, considering how many more people are getting tattoos now, how that association still persists. Of course, this doesn't mean if you get a tattoo, you're going to have a mental health issue or you're going to have sleep problems, but there just does appear to be a link.
I wonder what the sleep problem issue is there.
I don't know if people who suffer from insomnia are more likely to go out and get a tattoo, but let me tell you this, they do recommend waiting about 6 months before you get one because a lot of people regret them in the end.
Just don't do it right away.
In other words, don't your design, think about it.
Right.
Think about it again.
Again and again, and if you want it, then get it.
And a little less fried food as well.
Right, no fried food while you're getting your tattoo.
Now I want
Doctor,
fried food.
Thank you very much. We have much more still ahead.
The news at 6 o'clock starts right now.